So this is pretty interesting. So this comes from CNN, and it's Joe Biden. Joe Biden answering a question from a voter who basically says that she is believed to have coronavirus based on symptoms. She can't get a test though, so she's got a mask, and she talks about how they're unemployed right now, and then also talking about how she pays out of pocket for health insurance, which is $2,000 a month for health insurance premiums. And she basically asks him, hey, we're unemployed, we're not making any money, but we have $2,000 health insurance premiums. What are we supposed to sacrifice to pay for those health insurance premiums? And Joe Biden doesn't seem to have a very coherent answer per usual.
I'm wearing this mask to protect my family as I've been diagnosed based on my symptoms for the coronavirus. Although I cannot be tested due to the limited number of tests available here in New York City. My husband and I are both hardworking, college-educated Americans who, like countless other Americans, will suffer as a result of this pandemic. I work full-time for a small company that does not offer health benefits. My husband is a freelancer. We currently pay over $2,000 a month for health insurance for our family of 3. My question for you is that when our savings account inevitably runs out due to him not being able to work right now, what is it that we sacrifice? Do we sacrifice food, rent, or health care?
You should not have to sacrifice anything. Let me say that again. You should not have to sacrifice anything. Not just because it's the fair thing to be taking care of your entire family and every family in your circumstance, but because it's best for the whole country, the entire economy. It's not just doing a favor for any individual. Number one, your health care, you should not have to pay a penny for testing, and it should be available to you by now. We were promised it a while ago. It should be available for you to be tested and determine what needs to be done. Number two, the House just passed an unemployment proposal that increases by $600 the unemployment insurance you'd get, whether or not you were you had been covered by unemployment insurance or paid into it before, including your husband, who may have been, he's a entrepreneur on his own, doesn't have employees. You will be covered. And that should be done, but that requires the federal government to help the states set up the unemployment offices in a way that they can handle this enormous call on the need for being the unemployment insurance. Thirdly, the cost of a test should be absolutely zero for you, number one. And number two, I think the House and the Senate are going to have to go back and make sure anything...
So yet again, you've got this really incoherent answer it's really not even so much incoherent as it is just a dodge. Like, he didn't answer her question there. So he's trying to say testing and treatment for that should be free. Now, what's really interesting to me is actually, I want to know what it is about coronavirus that makes it so that should be paid for and free, but something like a stroke or leukemia, the chemo that comes along with leukemia, shouldn't be covered. That's what I want to know. I genuinely am curious. What is so special about the coronavirus that makes it so that should be free for you, but if it's a stroke or if it's leukemia or something like that, why should it not be free? Is it just because of public safety? It doesn't have to do with the person themselves? Because then it doesn't have to do with the person's, lack of economic ability to pay for it. Then you're just talking about, it's just a threat to other people. It's like, you don't even care about that person. You're just trying to make it so it doesn't spread to other people. So that's a whole nother thing. But those things don't have anything to do with each other. Even if you cover the coronavirus treatment and the testing, if you have $2,000 health insurance premiums per month, but you're unemployed during this crisis and you can't afford it, how the fuck is free testing and treatment going to help you? You can't pay your goddamn premiums. And then you get sick, and then you don't have health insurance because you couldn't pay your goddamn premiums. So Joe Biden not answering the question there at all. And it's just embarrassing at this point that anybody would make I can't believe we're legitimately having an argument about whether or not people should have health insurance. Like, seriously, like whether or not, like, we're talking about something life and death here. And you're talking about we shouldn't guarantee healthcare as a right. And we shouldn't guarantee healthcare. Not so much guaranteeing it as a right, but just giving it to everybody in the country. It's pretty embarrassing that that's the debate we're having. It's pretty sad and depressing, actually, that we're having this debate. But Joe Biden represents the old guard. He literally looks like he's dead. I don't even think Joe Biden's alive. He looks like a corpse. Maybe he's even a costume at this point. But that's why I'm not voting for Joe Biden. I mean, I'm in California, so it's not like my vote matters anyways. But I won't vote for somebody who represents the old guard and is not in favor of Medicare for all. And in the face of a global pandemic and people's lives basically being cratered, is still anti-Medicare for all. Yeah, Joe Biden can go fuck himself.